ports.
Yeah. I only use it about 3 times a year.
Nice, that's really good.
That's kind of where I'm at right now, but I know that will change someday, I'm sure.
It might not.
It might or might not.
Yeah.
When the smoke starts.
So you stay active, right, like we are doing, and don't smoke, for heaven's sakes.
Mhm.
Some of those groups I get on with Facebook, I can't believe how many people still smoke.
Yeah.
I'm
It's got a hold on people, for sure. I was gonna tell you actually, before we get started on the presentation, QuitGo
Yeah.
made a new product called Air Blast,
Okay.
and it looks like a vape.
Oh, really?
That's smart.
Yeah, it's like a little, it looks kind of like a Juul. But it's,
I'll have to go online and get some.
yeah, you'll have to try it out, because I sent them an email and asked them if they would send me coupons or like
Yeah.
or a trial or something,
Yeah.
but they haven't written back yet. But we just found it like last week, we found it online.
No kidding. See, because this is what saved me.
Oh, that's the
I just-
show, right?
I told him your story.
And you're the one that turned me on to this.
Yeah, they're pretty cool. Yeah, but now they have a vape alternative, so that's kind of a, yeah, that's a little thing.
I wonder if our hospitals will let us give to patients.
I don't know. We could try. I emailed QuitGo to see if they'll send me coupons or something.
Yeah, that's a good idea.
Okay, so the presentation today is getting the most out of your inhaled medications. I'm Audrey. I've met all of you now, but if there's anybody watching online, I'm the educator for the Meridian Hospital.
My name's Dan.
Dance.
Yeah.
Okay, Steve.
So yes, we've got Steve and Trish here in person, and Dan is the educator in Nampa, and Tara is the educator in Boise. So we're Treasure Valley covered.
Just need Eddie now.
I know, we just need Eddie from Matthew Valley. So the outcomes that I am expecting for you guys today is to be able to explain the importance of proper inhaler technique and effective treatment, identify the factors that go into selecting the right medication and delivery device, communicate with your healthcare team about medication delivery options, and select, use, and care for your nebulizer for a nebulizer that works best for you. So we go into why use inhaled medications, and I brought along my little lung models here. So when we're using our inhaled medications, they don't actually work on the air sacs down here. What most of them work on is the tubes that go down into your lungs. So I'll pass these around, but these are these are airways that have some alternative anatomy here. So this one is hypersecretion. It's got a lot of mucus in it. This one's got swelling, and this one's got a muscle spasm. So you can see how tight these airways get.
This is in your trachea?
This is so you've got your trachea, and this is actually in your bronchioles, so the
Bronchioles,
split. Yeah. And so this is like a normal one, and then this is a hypersecretion airway. So what we do when we inhale these medications, we want them to get all the way down into the lungs, as deep as possible, because we want them to, depending on the medication, relax the muscle spasm that opens them up, or helps with the inflammation, or prevent the muscle from constricting down in the first place. So there's 3 different types of medications that we typically prescribe, and they all work on one of those tissues there. Mm-hmm. Yeah, so next one. So the role of inhalation technique in treatment is, so the inhaled medications are only effective if they reach their target. So that's getting all the way down into your lungs as far as possible. If like you don't use the spacer, like you said, most of that medicine is going to get into your mouth and throat and not land where you need it to work. So the proper use of inhalers during the drug delivery and will affect the treatment outcomes. Over 30% of users make critical errors in the use of their inhalers. This could be coordination between actuation and inhalation, improper speed or depth of breath, or no post-inhalation breath hold. So if you breathe it in and then blow it right back out, medicine's not going to do very much for you. So poor technique results in increased exacerbations, hospitalizations, ED visits, and use of oral steroids, which we want to minimize as much as possible. So common challenges to proper technique are that patients are rarely trained in their specific device and how to use it. Healthcare providers lack time and familiarity with all the different devices, so they don't have the information needed to provide guidance. Regular monitoring of the technique in routine visits are rarely done, and switching from one device to another can be confusing. So lack of symptom control is thought of as a medication issue and not necessarily a device issue, but as we'll see, that's also a factor. So the types of delivery devices, we have the standard meter dose inhaler, like this one here. This is the one, the boot shape with the propellant that we want to use in the spacer. Then we've got the dry powder inhalers like the Advair Discus or Wixella. We've got soft mist inhalers. We've got Ellipta devices. We've got other meter dose inhalers that have a little bit different technique. And we've got nebulized medications that go into the nebulizer machine and hook up to the nebulizer machine, the little air compressor. So the factors in the device selection, so the characteristics between the medications prescribed, severity of the disease, physical challenges to proper technique. So if you have really bad arthritis in your hands, you might not be able to do one where you have to squeeze the canister, or this one could be pretty difficult for people to twist if they don't have the grip strength. Tremors, poor vision, memory and comprehensive issues. And then of course, cost and insurance coverage are a major issue. And then personal preference. If you don't like the dry powder inhaler, then you're not going to use it, then it's not going to work for you. And then when should you consider using a nebulizer? So medications via the nebulizer are billed differently through your insurance. So they're billed through Medicare Part B. So that they might be less expensive copay. So that's something worth looking into. If you're having difficulty using the inhaler, a nebulizer is a better option. If you feel like it works better for you, it's a better option. And again, insurance coverage. Some people feel like they get so short of breath that they can't take a deep enough inhale needed to be able to use their meter dose inhaler with the spacer. So when they are so short of breath, sometimes just using the nebulizer is a better option because you can just sit and breathe on it for a little while. So the advantages of the nebulizer is that it doesn't require any kind of technique. You just sit and breathe on the mist. But the disadvantage of that is that it's going to take anywhere from 5 to 25 minutes, and 5 minutes seems very short. I would say closer, most home nebulizers are going to be like 10 to 15 minutes at least. So they do provide a lot of different types of medications, and concentrations can be adjusted, and then higher doses can be delivered through a nebulizer. And a lot of times they can be less expensive, but it does take a lot longer to take your treatment. It's bulky, it requires an energy source. You have to plug it into power for it to generate that air compression. And then it does take some cleaning and assembly, which can be challenging, especially if people have visual issues. This doesn't come set up like this. It comes in all these different pieces all separated, and you got to put the puzzle piece back, together. So that can be challenging. And obtaining a nebulizer. So for most people, what you're going to do is just talk to your doctor about it, and you can get one from a DME provider like Norco, Landcare. CPAP Now has them. You can also purchase them from pharmacies. Sometimes you just purchase it outright. Some health plans require you to go through a DME. Other times you can get them from an online pharmacy. And these only last so long, so these need to be replaced. Usually I think it's about every 30 days you get a new setup. Could be longer than that.
In the hospital, it's every week.
Yeah, I think at home, I want to say it's 28 days and you get a
So
new one.
28?
You get a new one, unless you have a specific disease condition where you're at more risk for infection. And then, of course, the compressor performance may diminish over time. And typically through Medicare, you can get a new nebulizer machine every 5 years. So if yours is, 10 years old, you can get a new one and do it because it'll work better for you. So for the nebulizer, I didn't bring one, but there's a mouthpiece like this, or there's a face mask. So this is really good if people are can sit and breathe on this, or if they're claustrophobic, they use the mouthpiece. The face mask for people who are claustrophobic can sometimes be a little bit challenging. And then the face mask does increase the risk of the medication getting into your eyes, and certain medications like ipratropium can cause some eye irritation and temporary pupil changes. So we want to avoid that.
The new ones have better ends on them than the plastic tubing.
Good.
These tend to pop off.
Yes, they do. Yeah.
And the new ones have a more solid end,
Good.
and they're much better. Yeah.
That's good. You must have a better one than this is what we hand out. So you have a better one than we do in the hospital. But ours aren't meant to last for very long, so that is another.
Yeah. These they wear out, and you have to hold it in place while you're using it.
Yeah. Oh, yeah. You mean this end pops out?
Yes.
Yes, I have heard that.
Yes.
Yeah, I have heard that. And so it pops right out of the compressor
Or out of your hand.
on this side.
Yeah.
Yeah. Oh, that's very annoying. That
Very
doesn't-
annoying.
That doesn't work very well. So the ABCs of using your nebulizer. So first, of course, is assembly. So putting it together, following the instructions. They're all a little bit different. They should look something like this. This piece, some people take it out because they think it's not necessary, but this is actually a reservoir. So when you're exhaling, it fills, and then when you breathe in, you get a fuller dose of the medication. So read the instructions. And then, of course, put the plug into the compressor, turn it on. Then the B is breathe. So breathing, sitting upright, breathing in and out through your mouth. If you're using mouthpiece, close your lips around it, breathe through your mouth. Sitting in upright position is really important because if you're laying down while you're doing it, you're not going to take as deep of a breath. It's not going to get them as far. It's not going to reach these distal airways that we need it to reach. And then continue using the medicine until it's gone or you don't see any mist. If you have to interrupt your treatment, turn off the compressor so you don't waste your medicine. Take a break. And then clean. So the nebulizers can harbor germs if they're not cleaned and stored properly. After each treatment, disassemble and wash the nebulizer parts in warm soapy water or in the dishwasher. You can set them out, let them air dry. This part gets forgotten, I think, the most. Oh, clicking on things. So once a week, you can soak all of the parts of the nebulizer device here in water vinegar solution. So they said for 30 to 60 minutes. I would do like 50-50 water and white vinegar to disinfect it. And then running the tubing and compressor the tubing and the compressor can be wiped with a damp soap or soapy cloth. You don't need to wash the inside of this tubing.
I can't believe that would go in the dishwasher.
This one, yeah, top rack. Some of them will and some of them will not, but I would put it on the top rack and it should be okay. But yeah, it is pretty flimsy. There's the home ones have a little thicker plastic, so they're meant to be cleaned.
Yeah.
In the hospital, we throw them away once a week and get a new one. And that's something that I know I could speak for, at least for St. Luke's, is we keep track of it. It's in your record that when this was opened and used, and so we do get rid of them every week to make sure that they don't harbor any infection. And there are other types of nebulizers. So the ultrasonic and the vibrating mesh nebulizers have specific cleaning techniques. And so if you have to have one of those types, some medications require a very specific type of nebulizer. And if you have to have one of those, make sure you read the instructions or ask your DME provider. There is more information on lung.org. That's American Lung Association's website. And I have some flyers up here for the free Lung Health Navigator program. So that's an education series that they do over the phone or video. And they can talk to you about any questions you have about any lung diseases. So the key points to remember: a proper inhalation technique is critical for medication effectiveness, when to use your device correctly, and the different types of devices. It really depends on what your typical regimen is. So do you mind sharing, I think you're on Trelegy, aren't you?
Yes,
You're on Trelegy?
yes.
Okay. And then what do you want, Trish?
A Noro.
Oh, you're on a Noro. Okay.
Because the Trelegy, I had an allergic reaction to that. I don't know what's in it, but they switched me over to a Noro.
So Trelegy and a Noro are both this Ellipta type device. The only difference is a Noro doesn't have the inhaled steroid. And the
that's it.
Trelegy
I'm
does.
allergic to steroids, I guess.
Yeah, it happens, which is, you think it's bizarre because most allergies are treated with steroids, right?
Yeah, exactly.
Yeah, but it happens. So I wanted to show you guys the proper technique for this. So it has the counter on the front. This one is at 6. And so it's red, as in I need to reorder my inhaler because we're getting down to the last week. What you're going to do is you're going to open it all the way to the side until it clicks.
You have to hold that horizontal.
I would hold it upright like this when you open it.
Okay,
So this is a dry powder inhaler.
yes,
And if you tip it or tip it or tip it, it's going to spill. And so you'll miss your dose.
yes.
And this, I should have brought it, but I've broken into one of these and I have it all taken apart. And the amount of medication that you're inhaling is very, very small. So you don't want to spill any of it because it's precious. So you're going to open all the way. That loads the dose by opening that blister pack. This is the air vents here. So you don't want to cover the air vents. You're going to hold it like this. Then hold it like a sandwich. And then you're going to blow out away from the inhaler. So put your mouth on it and inhale. Keeping it level, you just don't want to tip it. So level or like this is okay, but just don't tip it. So you inhale to full breath, hold for a few seconds, and then slow exhale. That way you're doing a nice slow, a slow, even breath in, and then a slow, even breath out. So you're not causing lung turbulence and the medication is depositing in your lungs as much as possible.
Yeah.
And usually I can't hold it that much. It just wants to go, It's
Yeah.
almost like I remember like smoking dope. And you get it in and it's just like expanding and you just push down it goes. That's how this stuff is. We can't hold it very long.
Do you ever feel like you have like it affects your voice when you take it? Okay. Has that ever happened to you, Steve?
No.
Okay. Some people have reported that it makes their voice kind of hoarse when they take it. And for those people, we say inhale a little bit more slowly because you're actually breathing in too fast and it's too turbulent. You could try breathing in a little more slowly.
But I want to try to hold it in about 5 seconds if I can.
As long as you can for the hold. Yeah, because you want it to be able to settle in there and sit on like down as deep and far in your lungs as you can get it. So yeah,
That's a
because
struggle.
it is. Yeah, with the dry powders, it's hard. Yeah, and you probably, even though you can't hold your breath for that long, you probably are getting a good amount of it deep in there, because your symptoms have been better since you've been on it, right?
Well, I don't know that I can really say.
Mm-hmm.
I still have days where I can really feel that I'm short of breath.
Okay.
And maybe it's like if you do too much bending over, cleaning. And
Mm-hmm.
I was told it's because you're smushing your diaphragm or something is making it harder to breathe. Hot days, sometimes it's more difficult. So,
Yeah.
But I knew before diagnosis, I had been living for 3-4 years with,
Yeah.
something's happening here that I'm not too happy about.
Yeah,
Yeah,
yeah.
so.
Yeah, okay. Well, there are other options for you too. If you don't like the dry powder inhaler, there's another one called Bevespi, which would be, it looks kind of like this, but I want to say it's yellow. Maybe the breasttree is yellow.
Does it have the steroid in it?
They have one without the steroid. They have one with, it's the same company, but one with and one without the steroid. And it's a mist that you would use with a spacer. So it might be something worth trying for you.
I'm gonna see my doctor Wednesday, so I can discuss that.
Yeah,
I'll
just,
have you write it down.
I will. Yeah.
And we'll see. But what I like about my Anora is I don't have to quick rinse out my mouth.
Right. Yes. So if you are using like Trelegy with the steroid, you need to rinse your mouth out. But if you don't have the steroid in it, you don't have to rinse
You
your
don't
mouth
have to
out.
do it?
Yeah, because that's the one.
I want thrush.
Exactly.
No.
Exactly. Okay, that was the whole thing. So I have, we can probably end the recording. I have this other device here that we can use to make sure that your